Series 5 dental chair. Some of the nice features and functions of the Series 5 dental chair include our dual articulating headrest. So the headrest can come all the way down. This is very useful if you have a child. It allows the child to actually put their head on the headrest and utilize it. The headrest is activated by pressing a button, so it's very easy to move, and you can do it with one hand. Something I always recommend is that when you have the chair reclined and you have a patient in it, if you would like to adjust their head, you can change the angulation so you can get to the maxilla or the mandible. But always put your hand under it, because the weight of the patient's head, if you just hit that button, will cause this to go back. So you always want to make sure that you're supporting the head, press the button, and then adjust the headrest to the position that you want it in. Another interesting feature about the headrest is if you have a handicapped patient, you can place the headrest backwards, wheel the handicapped patient in, have them come up and lay their head backwards. So if they're in a wheelchair and you cannot move them from the wheelchair into the dental chair, you do have an option to still be able to treat them doing stand-up dentistry. Final point about the headrest is that if you find that it goes in either too easily or too difficult, there is an adjustment. You can adjust it. There's a small set screw right to the right of the bayonet where you can tighten that up or loosen it, and it will decrease and increase the tension on the headrest. The back of the chair is a steel back, and it can be cleaned with Cavicide or something similar. Although with all the dental equipment, we do recommend that you come back with soap and water to remove the Cavicide buildup on a regular basis. The chair has a swivel function. By moving this lever, you can now swing the chair left 30 degrees and right 30 degrees. This allows for, like I mentioned before, handicapped patients, easier access. You can slide it over and bring them in from the hallway and have them rest their head on the headrest. Or if you just need more room in the operatory away from the 12 o'clock cart or wall or cabinet that you have there. The armrests for entry and exit do rotate out on both sides, so you can rotate them. They don't go all the way back, because what happens if they go all the way back when the chair is declined or reclined is that they could get in the way of the wings and cause an interference. So they go far enough out so that, again, if you had a wheelchair patient and you needed to transfer them, you can use this as a point to hold on to as the patient is transferring into the chair. It also is a great option for people who need a little bit of help. Maybe they've been sedated, or they're just a little woozy after the dental practice. After the dental appointment, they can get up and exit the chair comfortably. There is a foot control that comes with the chair, and it works very similar to the touch pads that we've talked about in the past. To the right is the incline and left is decline, and then to raise and lower the chair you press up and down. And then on the sides you have the 0 and the 1, which show you, which allow you to go to those preset positions. A little trick that I tell everybody is to position the ball of your foot right on top of it, and then you can just rotate it back and forth to operate the chair. So many people I see start mashing on it, trying to hit all the different sides. That's not good for the touch pedal, and it makes it more difficult to operate. So if you just balance your foot right in the center, you'll be able to feel that you can control the chair very easily that way. One last thing about the chair is that it does have kind of a hidden feature about it. Let me raise it up a little bit and we can show this to you. Underneath this chair itself, there's a plastic cover, and inside of there are some tools. These will make all the basic adjustments that you need to make to the chair, including adjusting the headrest tension and any of the small joints. If they tend to get loose, there are set screws inside of each one of those, and you can use these tools to tighten it up and give it a little bit more stiffness so they don't move around quite so easily. Thank you for purchasing DCI, and if you have any questions, please feel free to let us know. Thanks again.